Welcome to my educational video of an ankle arthroscopy with removal of a loose body and debridement of an arthritic bone spur. On this x-ray we can clearly see a loose body on the neck of the talus as well as an osteophyte or bone spur on the tibia. This particular patient had severe pain on the front part of the ankle which limited his ability to run, walk, and participate in sports with his kids. After a systematic examination of the ankle, this showed a relatively normal ankle except for extensive synovitis in the anterior and lateral aspect of the ankle and a loose body. The loose body is encased in synovium, a lining of the joint. A probe is used to feel, move, and manipulate the loose body and see that it is freely mobile. Once it has been identified and probed, I realize that it will be difficult to remove because of the bone spur and synovium that are holding it in place. A shaver and burr are used to remove the bone spur and synovium from around the loose body. This will free it up to allow for easier visualization and removal. An Arthrocare wand, which can vaporize the tissue that it touches, is used to remove any of the remaining synovial or capsular attachments to the loose body. This will allow for an easy removal with the grasper. When all the synovial attachments have been removed, the loose body is mobilized and the grasper is inserted from the portal and the large fragment is removed. The bone spur that remains on the talus will be burred away. The talus needs to be smoothed out to create less impingement and to restore the normal shape and contour of the talus. Once the work on the talus is completed, I will turn my attention to the anterior aspect of the tibia, where a small burr is used to remove a bone spur that was identified on the preoperative x-ray. Usually a large enough amount of the spur and abnormal cartilage are removed to restore normal anatomy and prevent any contact with the tibia on the talus. Care is taken to avoid injuring the capsule as this could lead to complications. Once the spur has been completely removed, a shaver is inserted to remove any cartilaginous and bony debris that was created. The ankle is then taken through full range of motion to assure that there is no bony impingement. The patient is started on an aggressive rehab program after the wounds have healed. Within a few weeks, this particular patient had returned to walking, running, and sports participation.